Welcome to ICC Region 1 Radio, the podcast dedicated to exploring topics in building and fire safety. Today, we welcome Chief Ray Reynolds. Chief Reynolds is the Director of Fire and EMS for the City of Nevada, Iowa, with a career spanning over 37 years in the fire service and public safety. In this episode, we dive into community risk reduction, fire prevention strategies, and firefighter safety. Chief Reynolds shares insights from his work, including a statewide smoke alarm initiative to reduce fire deaths, and his national advocacy for thermal fuses in home oxygen therapy to prevent devastating fires. We also discuss innovative fire safety programs and the importance of policy change and data-driven solutions in reducing risk. All right. Well, hey, good morning, Chief Reynolds. Welcome to ICC Region 1 Radio. How are you?
I am great. Thank you for having me. It's quite an honor to follow some of the big shoes that have been on your podcast.
Yeah, like we were just talking, like I said, I'm very persistent in trying to acquire my guests to be on the show, and I think that there's definitely a lot of topics to cover, and we try to do everything that we can to cover everything from building safety to community risk reduction, and it's a very wide topic and diverse topic, and we really try to capture as much of it as we can.
Absolutely, and I follow it quite often.
Well, I appreciate that. Well, hopefully you can share this episode, far and wide with, all of your, fellow, fire chiefs in your neck of the woods, and maybe we can, continue to grow the podcast and get some more views here.
That sounds like a good idea.
Well, welcome. You and I have worked together. I'm now in California. You're in Iowa, but we've been together. I started my career in fire prevention with you in the state of Iowa. So it's everything comes full circle. I think I've been at it for 20 years now. I'm sure maybe you've just a little bit longer.
Just a little bit. The gray hair will tell you. Yeah, about 37 years.
Yeah. I shaved my head so that way you can't see the grays anymore.
That's a great strategy.
Well, Chief Reynolds, again, thank you. Can you share a little bit about your background, your journey to the fire service, and how you are now in your current role as the Nevada Fire Chief?
Correct. Yeah, our city was formed in 1860, so we think we were first in the pronunciation of that. But it's still I get that quite a bit. But yeah, I started at 18 years of age, volunteering in North Liberty, Iowa, on the fire department. It was something that I felt passionate about, serving in the community. That really developed my roots because that was such a great department with good camaraderie, and it was in the 1986 era, about that time frame when fresh off of emergency was still active, and we had demand valves and oxygen bottles, and we really, to look back and think how far we've gone is really amazing. But I served on the fire department in North Liberty. I was hired by the state fire marshal's office. At the same time, I was a police officer too, because that was really kind of my childhood dream of being a police officer. So throughout my career, I've been a certified officer in some capacity and also on a fire department. So I've journeyed through about 5 fire departments because my career kept moving me. You know how the state is. Yep. And I still tell everybody you were the best hire we had.
I appreciate that.
Yeah, great inspector, and it was such a loss when you left. But I think I was on to investigations by then and stuff. But it was really good to reconnect. But I went in the state fire marshal's office from the prevention ranks as an inspector to flammable liquid inspections.
Yep.
I went on to become an agent with the state fire investigator on the bomb squad. I took a stint at the FBI Joint Terrorism Task Force as a task force officer on loan to the FBI. And from there, I made the critical decision I wanted to be a supervisor, and my whole life changed. And I became a special agent in charge in the Intelligence Bureau. And then an opening came open, and they said, you're going to be the next state fire marshal. So I served in that capacity for 3 years, and That's about the term limit for some fire marshals. And
Yep.
the group of fire chiefs that I knew as the fire marshal were people I really looked up to, and I knew when I left the state fire marshal's office that that was my next calling, to be a
Hmm.
fire chief in Iowa. So that's kind of how I ended up in Nevada.
Okay. Well, so, you've definitely had a lot of, impactful career experiences. Can you talk about maybe some of those career experiences that have shaped your thoughts on community risk reduction and fire prevention?
Yeah, I think I've always been an operations kind of guy on the fire department. I love job town. I love being able to fight fire with folks.
Hmm.
It's a lot like the military when I was in the military, mission oriented. Um, but I've had a couple of experiences where children have died in fires, and
Yep.
the impact of that has been really kind of eye opening. Clinton, Iowa started a program where they put smoke alarms in every child's home, K through sixth grade. And it's a program I don't know that they still do, but there was one point where every grade, every student coming into the district had smoke alarms installed by the fire department in their home.
Hmm.
And the chief at the time said, you should do that at the state level. And I remember pitching the idea to my staff, and they're like, you're crazy. It's too big. We don't know. And I had some conversations with Casey's, the general store headquarters in Ankeny. And I walked out the door with a check for $200,000 in a 12-minute presentation, and I knew that
Wow.
we were onto something. So probably the biggest impact. There's a couple of things I think are important. When a child died under my watch, there were 17 of them that died in Iowa when I was state fire marshal. I went to their family members, and about 3 weeks later, and I wanted to learn who these kids were, because
Hmm.
I think we oftentimes get focused on numbers, like
Right.
they're a statistic, and I think it's important to remember that these 17 kids could have done something amazing like cured cancer, or but they
Hmm.
didn't have a life, and that had a huge, profound impact on me, and I wanted to prevent these deaths. I know that fire deaths are preventable, and we just got to
Yeah.
put the effort towards them. So we started the statewide smoke alarm program on the 100th anniversary of the Iowa State Fire Marshal's Office. In the short amount of time that we were doing it, about a 2 year span, 2011, 2012, our fire deaths went from 48 to 22. And we had a majority of career departments and a lot of volunteer departments installing smoke alarms in homes. And so we were up to 60,000 smoke alarms.
Wow.
We were the model for a lot of states like Tennessee. And, we just saw that this spread, Mississippi, Louisiana, we just saw that our program was copied. The true benefit came when the American Red Cross said, we're going to take your program and take it national. And
Mm.
so to date, the American Red Cross does install smoke alarms, and that started as a result of our town blitz in Lakeview, um, where we had Lake City, where we had 4 children die, and we just blitzed the town. And so I think that's a true testament that the Red Cross is well over 5 million smoke alarms installed since 2011, and it's got to have a profound effect. The only other thing that I can think of is I like to do things with partners, and one of the things we did, obviously in the world of prevention, is we still hold the world record in Iowa. Well, we did. There's another state that beat us out, but we have the world record for the most people that did the stop, drop, and roll at a
Oh,
single
that's
event
right.
at the state fair.
Yep.
And the last thing is, I wrote a grant for our state and included about 30 partners, different fire departments, and we studied with the University of Iowa the impact of legalization of consumer fireworks, and found just tremendous data in their research. And so it's about answering questions that we don't know, and
Right.
that's really been the drive for me.
Yeah, you right there. You hit on the importance of data analytics, but there is, there's stories behind those numbers, and identifying what those stories are, definitely help to kind of foster more of that community risk reduction approach. So that way we can definitely reduce the risk. I mean, I think we are all data driven. Can you elaborate? Like you talked about the smoke alarm program and those types of things, and then also, the idea of consumer fireworks and the risks that are opposed, or the risks that we could encounter with a community or with fireworks. Can you talk about maybe some other programs that you've introduced that and maybe have the impact on firefighter safety, but also the communities as a whole?
Yeah, in our department, we implemented a program that's support operations, and I think that's helped our recruitment. We, at the time, had 19 female firefighters in a volunteer department out of 45. And the support operations program is basically rehab techs, and we created a process at a fire ground where you don't just, in our day, you just grabbed the pack, it ran out, you went out, got another pack, and repeated that till you couldn't do it anymore. And so now what we're finding is we cycle our firefighters out of the fire. We get their gear stripped off of them, cooled down to normal operating temperatures. We get all the soot wiped off of them. We give them baby aspirin if they're at high risk of a coronary event. And we have found that we can cycle firefighters back into the fire scene quicker and more effectively by creating this process. And so that it's really been cutting edge in our state, and we're seeing a lot of people follow that. But I will tell you, when we face the cancer risk that we face in the fire service, we have found that we can decrease the risk by 400% if we can just wipe their neck and hands off and get their gear cooled down to normal temperature. So we're very serious about preventing preventable incidents in our fire department, and it's just a robust program that has really taken off for us.
Yeah, that like you just said, just a couple different procedural things can definitely help reduce the risk, especially associated with cancer rates and firefighters. I know that is definitely something that we do in our department. We're definitely starting to take a look at our PPE and how we launder that PPE, where we place that PPE, just to make sure that it's not impacting us as much as possible. So it is definitely one thing that I know that is a hot topic, especially in the fire service currently.
Well, it's interesting. I did a trip to the UK for the thermal fuse project to do a little research about their fires. And when I was touring their fire academy, they were coming out of practice burns and putting APR respirators on and going through a full decon. And they have their gear, rough decon at the scene, and their shower within an hour, and a complete set of clothing and gear are issued to them. So there are places in this world that are taking the firefighter cancer thing quite seriously. And I think, I don't know the whole approach to clean cabs and delay of putting gear on and all that stuff, if that adds to our problem. But I do know this, that we have a cancer problem in our fire service, and we need to learn from best practices.
Yeah. And if we're identifying programs that are working, we need to definitely take a look at and see if we can implement them here. So
Absolutely.
Now, we talked a little bit about experiences and things that have shaped your career. You've had some tragic incidents, I know, that have definitely, influenced your advocacy, especially for home oxygen therapy. Can you talk a little bit about your efforts in national advocate, because you're a national advocate for fire safety in oxygen therapy or long-term oxygen therapy. Can you discuss the risks associated with home oxygen use, and some of the mitigation measures that you advocate for to be able to improve safety in that area?
Yeah, we had two home oxygen fires about a year and 1 day apart. The first one was a patient who we've been to their house probably 20 times. We had a first name basis. We had a great relationship with that patient, but much like many of our oxygen users, the common dynamics or the victim profile is low income, either in a mobile home or a multifamily apartment building. We see that they're not ambulatory very well, and just a host of medical problems associated with nicotine addiction. Mm-hmm. These are people that have been smoking for 40 years and are on home oxygen. In the first case, we pulled that person out of the building, and they were burnt, about 50% of their body still alive. And when you look at who makes up the volunteer fire service, I filled a trauma closet for a 19-year-old firefighter who had been on the fire service for probably less than a year. that impact of that fire and knowing that individual. And we have programs in place for mental health. We have a chaplain program. We debrief and all that stuff. But that fire led to an attempted suicide. That fire also led to one of our members leaving the fire service and said, this is just too real for me. I can't do it. And so the negative impact of that fire really kind of woke me up that, this is different. This was a fast-moving fire that we got knocked down right away, but in the end, this person died within 24 hours, which is very common from the inhalation injuries. Then that second fire was probably even worse from the standpoint that one person died, two people needed to be rescued, and they had similar burn injuries. And they were actually hospitalized on a vent for about 45 days. They were Medicare recipients. And so the daily burn costs at the University of Iowa are about $19,720 per day. And so we attributed their medical bills equated to about $1.2 million.
Wow.
So here we had two fires with very similar outcomes. The rescue was needed. And so I started doing some research and I Googled how to stop home oxygen fires. And because these two fires, we fight, we get about 11 to 20 structure fires a year in a small town. But these two fires really were different for us. In my career, 37 years, I've seen two rescues. And so, this is Iowa. This is a small town of 7,000. Right. And so to have to do three rescues in 1 year really kind of said something's different. And so when we did the research, we found that this is happening a lot. In fact, there's a fatality every 4 days in the United States. And I came across the thermal fuse, the bidirectional valve that shuts off the flow of oxygen. And I wanted to know if it works. Like anything in the fire service, if we endorse it, we got to know it works. And
right.
So I reached out to the company that sells them to durable medical equipment providers. And then they connected me to BPR, which is the company in the United Kingdom that in England that makes those devices. So I learned a lot about this little $3 device, $3.80 device, and its impact previous to my knowledge on these fires. So the good thing that's turned out about this is that I'm a member of the Fire and Life Safety section for the I-Chiefs, and Greg Rogers is our chair, and Greg says, you're going to solve this problem in America. And I said, okay. So they put me in charge of a task force that involves about 50 stakeholders, and it's been very challenging because it's such a common sense thing, and I thought it was interesting, to be able to dialogue with surgeons from the American Burn Association, the COPD Foundation. Every fire organization is involved, NFFF, IAFF, and NASFM. So we really have the crop of who's who in the fire service and health world to try and mitigate this problem.
Yeah, and in my research ahead of this podcast, I found an article talking about home oxygen use and the fire risk associated with it. And like you highlighted, there's a person that dies every 4 days, related to home oxygen therapy and fire. But they even maybe indicated that there's some underreported incidences just based on like our current, model of our national, fire reporting systems and things like that. And I think that will hopefully help improve. We'll have better data, especially with the new NERA system. And you talk about the thermal fuse. Can you talk a little bit about what that bidirectional thermal fuse device does and how it stops a fire from becoming, maybe a large structure fire?
Yeah, when the device originally came out, it was single direction. So you had to put it on a certain direction on the oxygen tubing. And if you put it on backwards, it didn't work. And imagine the problem we'd had in the fire service relying on that. So the Department of Veterans Affairs actually in 2018 mandated thermal fuse technology on all veterans on oxygen since 2018, and that was based off of 700 fires that they experienced. And so they've been doing thermal fuses ever since. BPR made the bidirectional fuse. It's the only one in the market. And then you know, trying to get the data has been a huge challenge, as you say. We know anecdotally that they have had a huge reduction in fires. In fact, Dr. Schechter at Stanford University is doing an NIH grant to actually study the effectiveness, because we know the effectiveness in the UK and other places. And so, but you mentioned data, and one of the things that we've been doing, I've been tracking every home oxygen fire death in this country through Google spreadsheets. I call it the spreadsheet of death, because it really is the same story.
Yeah.
Every time. You could take the name and the date and the time of the fire, and but I'll tell you, one of the more tragic ones occurred in Iowa, where the home oxygen user had a fire. Her and her husband both got out of the house, but the renting apartment upstairs trapped the neighbor, and the neighbor died.
Oh, wow.
So independent person, not even connected to home oxygen, died in this fire. And so it's those secondary things. And the real thing about the valve is, when you put on oxygen, you have this zone of hyperoxygenation, about 80% pure. And
Right.
so the flammability rate is astronomical. That's your highest risk. And so what we see is smoking due to addiction to nicotine. The fire starts, they whip the cannula off their face, usually in a sweeping motion. It lands on the floor and then follows the tubing back to the oxygen source. So the idea of the valve is that it would stop the fire before it would catch the couch on fire or all the other material around there. And then at a last resort, in case there's 50 foot of tubing all curled up and it bypasses the shutoff, there's a shutoff at the concentrator. So we know that this technology works because in the UK they did a 5-year study. And in that 5-year study, they had one fatality related to home oxygen. One.
Wow.
And so, I mean, we have one every 4 days. And so,
How, when you talk about the UK and the data that they showed there, how many fires were they having before, the use of the thermal fuse?
yeah, so this case study went from 2013 to 2017, and they were able to track down 143 fires. And that's the interesting thing about a lot of this is everybody knows they've had fires, but nobody's really tracking it. And then all of a sudden they go, hey, let's put this thing in and see if it works. And I suspect that's a lot of what happened with the VA is that, they said, we got to do something. And that's generally the fire service's reaction. We've got to do something. And so they put the fuse in, and then they said, hey, lo and behold, it works. And now they mandate it for all of their veterans, not just high risk.
Yeah, and if the VA is recognizing the use, they obviously have done some studies to be able to identify that that it is effective. And I would think that we would start seeing that really across all federal agencies and really kind of a mandate across the country, and especially with the UK study. But I know that you definitely have been very active in that area. Talking about policy changes. With Iowa becoming the first state to mandate or be able to fund the thermal fuse through the Medicaid system. What challenges have you faced as you advocate for these devices? Because as you mentioned, they're $3.80, 83 cents. So very inexpensive. But what challenges have you encountered as you have been advocating for this change?
Yeah, that's a great question, Tim. I think the first thing is it was obvious to me that one federal agency, the VA, provides medical care, says you shall do it, and then you have a larger system called Medicare that says, hey, that's a good idea, we're aware of the problem, but you got to go through the process. So I was the first fire department to ever submit a HCPCS code request. Usually it's from a vendor that has a product they're trying to get. Everything in the medical world has a code for reimbursement.
Right.
And so there currently is a generic code that people are billing, Iowa's billing, and that's E0700, which is miscellaneous safety. The issue comes is that the durable medical equipment provider, the person that goes to the home, they don't like these miscellaneous codes because they're not guaranteed. It's kind of arbitrary on whether they'll get paid back. The issue is in 2015, the oxygen cost bundle, which is oxygen, tubing, all the accessories needed to be on home oxygen, that bundle changed from like $185 down to $85. So the profit margin for people who are in the oxygen business is about $3.
Oh, wow.
So if a fire chief now says, I need you to put 2 thermal fuses on at a cost of $3.80, you're now losing about $4 every time you drive to somebody's house, and it's just not feasible because they're not being reimbursed, and so or they're not being included in that cost bundle. So our goal was to have Medicare do a separate code specifically for the thermal fuse so that they can install them. In January, Medicare said, no, we think it's all part of the cost bundle. Sorry, good luck, and we'll try and work with you. So we started going state by state on the Medicaid side, which is the state's version of Medicare. Iowa, it was a phone call, and I told them what the problem was, and they said, yeah, this seems like a no-brainer. And then 3 weeks later, they sent me a memo that said, oh, by the way, we approved this. And so,
wow.
Yeah, it was as easy as a phone call. North Dakota, the Missouri Valley Chiefs for the I Chiefs, the Missouri Valley Division put out a position paper that said all of our states should pursue Medicare funding for thermal fuses. And so North Dakota was next. Actually, Washington, the state of Washington was next to do it. North Dakota and now Missouri just put out a mandate, which is a little different. Missouri said, thou shalt put 2 thermal fuses on all home oxygen users. And they increased the cost bundle for the state side by about 42 cents. So we're still trying to navigate what that means to the durable medical provider and kind of oxygen use. But at the end of the day, our goal is that all 50 states will have some sort of reimbursement for thermal fuses. We also believe that there's a huge grant potential here. And I have a meeting with AA Home Care, which is kind of the association for the durable medical equipment providers. And we want to find out, what are the obstacles beside cost to do this? Because when we surveyed the oxygen providers, 46% of them indicated they either knew a patient who died on oxygen or knew a patient that was burned. So that's a 50%, almost 50% failure rate in their industry. And I equate that to the fire service. If we only responded to 50% of our calls, or if we only put fire out 50% of the time, that would not be a successful rate. So I think at the end of the day, this is a huge, it's a math game, and it's about numbers. And so the research that Dr. Schechter has done shows that it is a viable, valuable U.S. policy, and we should have a national policy implementing this. So I think that's the next direction of where we're going.
Yeah, you talked about data and the spreadsheets that you keep, but I would imagine that the home oxygen therapy vendors also kind of keep track of that. Is that data shared between you and, or maybe between the medical provider or the durable medical equipment provider and maybe the iChiefs to be able to better track maybe some of these fire incidents?
So I don't believe that they're tracking oxygen incidents.
Okay.
From the information that I have is that they take the burnt cannula and replace it with a new one. And so I don't think that, they talk about furniture, carpet burns, facial burns, stuff like that in treating patients. So they know there's a problem. They know there's a risk. Interestingly enough, even our codes have now started to take a look at this. The ICC and NFPA, with Chief Marshall introducing different proposals regarding home oxygen. So, I think the tides are turning, Tim. If you look at the Joint Commission, who regulates and kind of approves hospital care, they put out in their 2023 patient safety goals, goal number 15 was reduce the number of fires involving home oxygen. If you look at the employee surveys for home healthcare providers, their number one fear is a fire related to oxygen. And, so if you look at the concentrator manufacturers, the top 5 people who make oxygen concentrators, they already require in their manufacturer's instructions some sort of thermal fuse to stop the propagation of fire. So I think the everybody's aware of this.
Yeah.
It's just you got to herd the cats and get everybody to agree that it's a big enough problem to take action.
Yeah. And you mentioned, being part of a kind of a larger group, especially with the International Fire Chiefs Association. There's definitely a task group of, many different disciplines and many different, organizations. Has there ever been a thought, we talked a little bit about maybe your work with smoke alarms and the American Red Cross, but, when using maybe, those types of, charitable organizations or emergency, those types of organizations to maybe help with some of the funding and maybe kind of pair a smoke alarm install with a bidirectional thermal fuse.
That's a great, that's what we wrote our grant off of this year for FEMA's fire prevention and safety. Our goal was to tie, there's tremendous value in home inspections,
Mm-hmm.
tremendous value both in PR wise and support for your fire department and in general safety and awareness. We all know that smoke alarms and home inspections go great together. And if we look at an all hazards approach,
Right.
that would be perfect. What we're doing, there are installation programs. Ohio's probably got the best. The state fire marshal's office funds thermal fuses. They provide them to fire departments, and they have over 60 fire departments installing thermal fuses in home
Wow.
oxygen cases. Now, here's the interesting thing: in 2 years, they indicate that 40% of their fatalities were related to home oxygen and smoking. And so they said they've had 51 fire deaths in 2 years related to smoking and oxygen. And it goes back to the data. There's smoking as a cause, but
Mm-hmm.
there isn't smoking on oxygen as a cause to our fire data, right? So,
Right.
how many of the 30% of our nation's fire fatalities related to smoking are related to oxygen? It's hard to say. But I think you're seeing we keep them in our vehicle. If we go on a medical call and somebody's on oxygen, we go, "Hey, do you mind if we do this?" And nobody's ever turned us down. And
Right.
so it seems to be working. We get the typical questions about liability and stuff like that we got
Mm-hmm.
back in 2010 on smoke alarms, and
Right.
my answer's simple. There is no case precedence ever set where a fire department has been sued for any sort of prevention program, whether it's smart burner installations, smoke alarm installations, home inspections. The case law just isn't there. And I think the courts realize that there's no intended negligence either. So if you're fearful of that, give me a call. We'll talk through it. So
Yeah. Yeah, I think that there is definitely an area there, right? Like you just said, I mean, this could be paired with home inspections. I was reading an article, I think, where Washington State, and you talked about Greg Rogers, but I think in his home department, they were, working with the hospital. And as people would go home, they would go out and install, work with them to install a thermal fuse, but also then a smoke alarm, make sure they have working smoke alarms, and then an evacuation plan. And I do think that there is value in that and being able to do that. Much of what we do, as you mentioned, is through grant funding, right? To be able to do some of these additional community risk reduction programs, because we try to do what we can. We recognize the risk, and how can we really work to reduce it and hopefully eliminate it.
I think one of the biggest concerns I had is the fire service is always the go-to.
Yeah.
And I wasn't trying to create another fire service program. I really want the durable medical equipment people who are there every 30 days to take ownership of this. And so at the end of the day, that'll be my goal. But till we get there, if we can reduce somebody's risk, because I'm telling you, man, we've all been on those O2 calls where somebody's on there and the house smells like cigarettes and stuff. But I got to tell you, in installing fuses, but there's been a couple human type moments for me. People that smoke are mainly embarrassed because of the addiction to nicotine. And some don't even want you to go in their house. But when you assure them, look, this is going to be fine, and you sit down with them and talk to them, our message in the healthcare world and in the fire world is what? You got to quit smoking. Well, we're not putting that genie back in the bottle, right? And with that addiction and how long they've been smoking. But to sit down with somebody who smokes and to tell them how to smoke safer has been very rewarding for me to tell them to shut the oxygen off, to go outside, to have a metal self-closing can on the porch and stuff like that. You can just see their personality change, like you're actually treating them like they're human.
Right.
And so some of the best interactions I've had in prevention are people that are in need of our services.
Mm-hmm.
And so while I love the kids and the school talks and indoctrinating them to be our next future prevention minded folks, it's the people that really need us that, they're still human. And I think
Yeah.
it's important that we don't lose fact that, their loss in our community is tragic to even us, And so that's an aspect I hope folks kind of take away.
Yeah, I think you hit on a big thing that many of us in the fire service we try to elicit is empathy, right? We try to try to relate to the people where they're at, and we try to have conversations with them. At the end of the day, we want them to be safer, and we're going to try to do everything that we can. We just try to educate as much as we can and work with them and try to meet them where they're at.
Yeah, absolutely. I think that's so important because we're getting those calls. These are our people. These are the
Yeah.
people we serve. And the more dire straits they are medically, the more often we see them.
Yeah, absolutely. Yeah, and I hope that I hope to see this program. I know I've seen you a couple different areas where you've been advocating for it and working really hard to try to affect change in this area. And I know that it's sometimes it can get challenging, but you are very persistent. I've been with you, and I've known you long enough that you will get it done. And it's definitely good to see, and hopefully we can definitely see a model program that many of us in the fire service can use. So,
well, I think we have the advantage in Iowa that every presidential candidate comes through here, and really, I gained a lot of traction when Mike Pence was coming through Iowa,
mm-hmm.
and my daughter served on the same ship that his son did, and we had a conversation, and he was able to connect me with his former cabinet member, Seema Verma, who was the head of CMS, and so she was able to connect me to the current administrator. And so the I-Chiefs and American Burn Association, we met with the chief of staff for CMS, and these are top level people that are decision makers, and so we definitely got attention and got awareness. I already have a request in to meet Dr. Oz, the current administrator of CMS, so I'm a bull in a china shop, and, I've always believed that if you don't ask the question, the answer is always no.
Right. Yeah, like I said, I've never known you not to be persistent and try to accomplish that goal. And so I would imagine that you will probably have a meeting with Dr. Oz very soon, and hopefully then we can definitely see some continued change in this area. So.
Yeah, I think it's really important that we keep fighting the good fight. And it's so easy to just pack up your suitcase and say, well, the city council doesn't care, the community economic development, and it's all about that. But at the end of the day, I think you still have to advocate your position. And that's always been an avenue. And there's a fine balance. I mean, we have challenges in our community that we deal with every day.
Yeah. Now, speaking with the challenges that you deal with in your community, as we kind of maybe, transition and think about, other areas of prevention and, educational programs with the city of Nevada, what other kind of programs are you working through in Nevada, to be able to help reduce risk?
So most recently, we're looking at kind of a mobile integrated health program. There are different Optima Health and different people that want to help people in need. We have, like everybody else, our number one call is lift assist and falls, and for a volunteer department. And we had 2 last night, and they never happen at 8 in the morning when
Right.
I'm sitting right here. But I think the trying to address the other needs that would help people, whether it's house cleaning, whether it's grab bars and stuff like that. So we're really excited about kind of where that program will go because we are a volunteer department. I'm the only career person on the department. The other program that I think is really important is we've taken a page out of West Des Moines' book. They have a Valley Junction historic district in West Des Moines, and the city ran a main through there, and everybody tagged in, and they put a sprinkler system. We have a town that's on the National Registry of Historic Places. Our entire downtown is.
Oh, wow.
It's 164 years of wood. We have a track record of having already burnt two city blocks in 1881 and 1883. So, but as time goes on and memories get short, the fire chief's the guy that's got to remind the new businesses that we've already burnt your block down twice. So,
Right.
and so we now have our first 7 R2 apartments above our historic district that are sprinkled.
Oh, wow.
So it's very challenging. We missed a huge opportunity when we did the streetscape during COVID. We tore up our streets to do our downtown. And if we'd have just taken a pause and put a larger sprinkler water connection in, we could have probably done a lot more good. But we do see some shared main stuff going on and trying to navigate our 164-year-old old buildings. So,
Right.
but I think that's probably the biggest thing that we're seeing is awareness and people kind of starting to buy off on it. It's not preserved until it's protected, and that's something that the U.S. Fire Administrator has said, and especially being in a historic district, that we have to remind folks.
Yeah, I monitor fire sprinkler saves across the country, really across the world, across the globe every month. I'm, kind of like you, I keep a Google sheet of all of the fire sprinkler saves. And it is fascinating to me to see how, one fire sprinkler head does such an effective job of suppressing a fire. And what it also does is it helps with property conservation. And many times the businesses reopen very quickly. And then also, too, it doesn't displace a bunch of residents. I mean, you'll see some water damage, but, that water damage is definitely reduced when compared to the overall fire damage that could have occurred. And it's fascinating to me to see how, fire sprinklers are starting to become a lot more commonplace. And I hope that we can continue to see that because I do think that they are very effective in suppressing fires. So.
Yeah, we have 3 examples in the same building that they have a sprinkler system, and it's unattended cooking.
Yep.
And we had the sprinklers put them out every time. And so what's interesting, though, to me is we went into these our kind of problem areas, and we put stovetop fire stops in.
Oh, yeah.
And I thought it was interesting. We haven't had a fire there since, knock on wood, but are we still having fires and just not being told about them? And so what's fascinating to me about CRR world is 75% of our fire deaths, according to some of the stats I've seen, are either related to unattended cooking or careless smoking or smoking on oxygen. So if you think about out of the 3,200, 3,400 folks that die every year, 75% of them are 2 causes, right? And we have an engineered solution for both of those. Smart burners there's some great projects going on in Massachusetts. But to think, a burner costs roughly a little over $100. And so you're talking $400 plus $3.80 for thermal fuses times 2. So the way I've done the math, I think we could solve 75% of our fire deaths in this country for about $456.
Wow.
And so, I mean, it just blows your mind that it's a math problem. It really comes down to being a math problem.
Yeah, and if that's something that we can definitely a policy change that we can implement, that would be outstanding. If we can find a way, like you said, 75% of the fire fatalities across the nation, if we could find a way to be able to do that, that would be that would be a good policy initiative. Maybe you're going to help change the world really in Nevada, Iowa. We talk about different things across this podcast, and we've talked to a lot of different folks. But it's always good and refreshing to talk with people that in different areas where you might not necessarily hear these stories.
Well, I don't know if I can change the world, but I said there's 2 things that I'm trying to do. one, I got to get reelected to the Fire and Life Safety Section Board. So that's my big challenge. And two, I always go up against world-renowned people too. But the second challenge is I think everybody wants to leave a legacy and leave a mark. And I have a great department. All of the folks support me so much as I go through EFO and different programs. But at the end of the day, I'm reminded by visiting those kids that died in fires, their families, is that this is about human beings.
Yeah.
And so if there's a legacy that somehow you and I, through our education efforts and activities, have changed a life, I think that's a pretty good legacy to rest on.
Absolutely, absolutely. Now, you indicated that you are part of the International Association of Fire Chiefs, and you are running for the board. How can more people find out about, one, the International Association of Fire Chiefs, and the different work that you're doing on the Fire and Life Safety section?
Yeah, this has been probably the best organization I've been a part of, and I was a member of NASFM on the board of directors when I was state fire marshal, but I've been able to write fire codes in the International Fire Code that impacted my community. We have a large problem with corn stalk bales that burn for 5 months that make alcohol at an ethanol plant. And I was able to work with some great folks and develop a code on biomass storage, and it made my community safer. And so I think they put me in charge of this task force on home oxygen because I led the valet trash group, and we now have an appendix in the fire code to regulate valet trash because that's a huge market out there. And so to be able to be involved in code development, to be able to know the issues that are taking place, corrugated stainless steel tubing, smoke alarm changes, and just the list goes on and on. It's really been rewarding to be a part of the Fire Life Safety section and to really hear what's happening in the world before it hits my community. And the benefit of that is that I go back to my community and I talk about issues that haven't hit us yet that are coming. And somehow I look like this genie, or that I'm like some fire expert and stuff. So it certainly helps in my community. But again, at the end of the day, these are some great folks. Karen Bernard Reed, I mean, there is not a person on this planet that knows more about CRR than her. And to be able to have those conversations with her about that. Mike O'Brien leads the lithium ion battery task force for the I Chiefs, and Chief Coco, and I mean the list goes on. And to have elbow room in the room with those folks is really important. So I would encourage anybody that's in the CRR world to get involved in the I Chiefs. You don't have to be a 5 Bugle chief to be in the IAFC. You just have to be passionate about what you're doing. And then, most importantly, if you do get in the Fire and Life Safety section, I am on the ballot. So certainly I would appreciate your vote.
Yeah, you hit it. You definitely hit on a very common theme and common topic on our podcast is the aspect of getting involved. So many of us that are involved definitely have a lot of get a lot of information that we can share with our communities, but we can also share with our other fire prevention professionals in our region, and it's always good. So I think that the more that we get involved, the more information that we have. It's all about sharing data, sharing information, and what works in one community may work in another. And so being connected is definitely one of those things. And that's actually one of the reasons why I started this podcast, is to be able to connect with so many other folks. One, for my education, but also then to share all the good works that other people are doing, and hopefully they can be able to take that information and use it in their communities.
Well, I can tell you, Tim, it's been a great honor to be a part of your podcast. When I watch folks like the New York City Fire Commissioner talk about lithium ion, the inflagration of lithium ion bikes and stuff like that, and the very next day I'm watching a lithium ion bike cruise through my little small town, and I'm thinking, I wonder where they're charging that. I wonder, and it helped us to put out something ahead of time, as these are trendy, but there's some real issues here and stuff. So tremendous honor to reconnect, and it's always great to see you. And I wish I was the fire marshal that hired you, but you were already on at the time. But it was certainly great working with you at the time. And I mean, you've really connected me to the folks out in the West Coast that, that's the thing I've found too is East Coast and West Coast, the fire problems that hit them eventually come to us. And
Right.
so to be able to learn about some of those things, I think is important. So thank you for your having me on. It's
Yeah.
I'm going to put this in my top career 5 highlights there, being on the ICC regional podcast.
Well, that's good. Well, hopefully this gets a lot of plays, a lot of downloads. Where can people find more information about, one, you as the Nevada Fire Chief and all the good work that you're doing in the central part of the country?
So if you want to go to the IAFC, you can go to the Fire and Life Safety section and look at our webpage. We have a dashboard on home oxygen fires that people can report home oxygen fires, because at the end of the day, it's about tracking the data. I also we have information on how you can get your state to approve thermal fuse reimbursement. And so there's a host of information on that. And in addition to that, I think it's really important is any topic that's impacting you, we probably have a position paper on it, and you can look at our section's position papers. And certainly Ray Reynolds, Nevada, Iowa, I'm easy to find. And, feel free to reach out to me if you have any questions or if you think there's something I could do better.
All right. Well, I appreciate it, Ray. Ray, again, thank you for your time. This was definitely very enlightening. I know that some that may not necessarily always be aware of, some of those risks, but it's always important to be able to share risks that they may not be aware of, because it may end up impacting them and their community. So thank you. I really do appreciate it.
Absolutely. Thank you, buddy.